It was a perfectly normal Saturday afternoon. I was on a friend's farm and my phone kept ringing in my pocket, and I ignored it for as long as I could, and eventually I thought I'd better answer it. And it was a lot of voicemails from the New Zealand police wanting me to contact them. So I rang through on the number and spoke to the policeman who'd been called to the scene of the accident, and he told me that Matthew had been taken to hospital on an air ambulance, and his life was critical.
We literally got home, chucked a toothbrush in a bag and left. And we were out of the country that evening. So didn't even have time to think about anything other than getting out there.
We arrived at the hospital and we were taken to the intensive care unit, and I don't think anything can prepare a parent for seeing something like that. Matthew was really severely injured. He'd been shot at point blank range in the back of the head, and the shot had travelled right the way through his head, and then the bullet had fragmented, and the fragments had lodged on the hard bone of his eye socket there, so his head was swollen up almost to twice its normal size. And the first few days we were just living in shock, and I don't know how you get through it, but you do somehow. You have to, because not coping is not an option in that situation. We had to give permission for an operation to remove the bullet fragments from his head. It was a very difficult decision, because if he survived, he may not recover, he may not make any recovery, and we weren't sure whether we wanted to put Matthew through an operation if he was going to make no recovery. But they talked us through it. Our surgeon, or the Matthew surgeon, told us that he could give us some of Matthew back. He couldn't predict how much he was going to give back, and that was probably enough for us to then decide that yes, we had to give him a chance. He was fighting, we needed to give him a chance.
The staff wanted to know us, and they wanted to know about Matt. They wanted to know who Matt was before his accident. They wanted to use that to be able to channel his recovery, I think.
So as soon as I was able to start doing therapy, they were all very well catered, and they had a whole department specially set up for people with brain injuries. So they catered very well for me, and they all got to know me and my personality very early on. They knew how to make me tick and work with my competitive nature and drive.
We were encouraged to be with him all day, encouraged to help with his therapy, be involved in his therapy. That made a huge difference.
When I first arrived home from New Zealand to England, my doctor at Poole Hospital, Dr. John Byrne, was waiting for me and to see me arrive back. And since my time back in here, he's always been a constant. So he's always been very involved in my case and support. It's been a massive help, and
if you're constantly changed from one person to another who's looking after the care of your family member, you've got to keep on going back over the same things, and you've got to keep repeating yourself, whereas we've had one person there from day one.
We always thought, first of all, we would have Matthew home with us, and we were told quite early on, particularly by all the OTs and people involved in Matthew's care, that actually the worst thing you can do is have Matthew home, because if you have him home, you will do everything for him. The best thing you can do is to put him, set him up in his own home with a support team or a care team that could help him there. Once Matthew left hospital, it had been very easy for him to have been abandoned and for nothing else to happen. And once the brain injury team took over, once Matthew was discharged from Poole Hospital, the most important thing, I think, with a brain injury victim, the people that do the best, the ones that have the best family support networks around them, and the families need to be consulted, they need to be involved, and the brain injury team recognise that.
We work with family and carers and involve them as much as possible in the decision making where we have that person's consent, and can also we have a carer support officer who also supports family and carers in their role and looking at signposting them to different services. My role as an occupational therapist in the brain injury service is primarily focused on people's function. So what is it that their brain injury has affected, that they're not able to do anymore, that they want to return to doing? How can I work with them on goals, and looking at, could be something as simple as a piece of equipment, and how can I help them move forward in their life in the direction that they want it to go.
Occupational health have been marvellous. They were here, helped with the house, and they've set him goals, which obviously being competitive, Matt has always reached all his goals.
They were there all the time to help me get through the early days and the worst of it, and I think through their support and constant help and encouragement, I've been able to make a good recovery, I think. They always make a point of coming to see me regularly, and they're always available for me to contact them if I need any more support or advice or anything. Well, to be honest, I can't really fault the NHS. The service they've given me since I've been back, it's been brilliant. But the only thing that a small thing would help would maybe to have the opportunity to meet other people who've had similar injuries or accidents as I have, maybe people of a similar age group, so I could share some experiences and talk to other people about what I'm going through.
Biggest things about Matt is that he always has a drive to keep moving in his rehab. He never wants to give up. He's never wants to settle for how it is now. He always wants to step forward.
Matt was never expected to walk. I always thought he'd walk again, so that was a big thing. I never thought he would shoot again, because I thought that would just be something he wouldn't be able to do or wouldn't want to do. But the very first day he came home from hospital, he had to fire a gun to see that he didn't have any demons. To see him skiing, I cried. So that was wonderful.
I think one of the real key highlights for me was when Matt's brother got married, and Matt actually wrote with support a speech for his brother's wedding. And I remember so from the team listening and going out and giving him feedback and listening to that speech. And then afterwards, the sense of accomplishment of how the whole wedding had done and how all the grading that we'd done to make that successful had gone.
I feel very fortunate to have this opportunity for a second chance, which a lot of people don't have, and so I want to make the most of it and do the best of myself and have the best future that has been made available for me.